welcome to another episode of Ask Nurse Vicky. I hope you are having an amazing week. I hope you're doing well. All right, so we're gonna continue where we left off the previous episode, and we're gonna be wrapping up on the health plans, because one thing we always emphasize and we always stress is your health is your wealth. And there is no amount is too much, to maintain that healthy and balanced life, or to do things that will make you enjoy your life. So I'm going to be sharing my screen, of course, so you can be able to follow along with me. Okay, so now we're talking about health plan. We have started this. We've had 2 episodes on that. And today we're going to continue and wrap up. But before I actually transition to what I want to share today, just want to wrap up on the Medicare. We have gotten quite question on Medicare, quite some questions on Medicare. And one thing you want to know is before you turn 65, usually 3 months before your birth month. So for example, if your birth month is July, as your birth month is July, that means the 3 months prior to July, that will be April, May, June, you have the opportunity to sign up for that. During those months, they will have sent you information to let you know you're eligible. So that is be April, May, June. And then July, your birthday, and then 3 months after your birth month. So pretty much total of 7 months that you have in between those 7 months to sign up for Medicare. So Medicare, the Part A, which covers your hospital stay, that one you have no premium for that one. So nothing is not going to cost you anything that you get. The only thing is Part A only covers for you when you're going to the hospital. So, but Part B, which happens to covers everything else, most of everything else, it covers your doctor's offices, your lab work, and all of those things. That one, there is a premium on that one. So you can go back and watch the first episode when we pretty much talk about Medicare. So that we have a premium, and the premium depends on, your household income. So depending on how much you make, that is what we determine how much you're going to pay premium for Part B. Now, here's the caveat to this. If you do not sign up for the Part B, because you have the options to just get a Part A, since there is no premium for that, and if you do not sign up for B at the same time you sign up for A, the same time you're eligible to sign up for Medicare. If you failed to sign up for B, you can get it later on, but Medicare is going to penalize you for the months or the years that you do not pay premium, that you do not have that Part B. So let's say, for example, if you were eligible for Medicare and you want in 2021, for example, and you only sign up for the A and not the B. Now 2022 comes, you now went to the hospital, or now you need to follow up to see a doctor, to do labs, specialists, and all of those things. Now you want your Part B. You will get Part B for the months you did not sign up for B. They're going to penalize you, and there is going to be a fee that you're going to pay for those times. And you will pay those fee for a very, very, very long time. So we encourage you, when you sign up for A, please sign up for B. And if you're someone that is Medicaid eligible, Medicaid, because Medicaid is not only for health, they consider your financial status. So they might be Medicaid, if you qualify and you have Medicaid, so Medicaid can pay premium for your Part B. All right, so you may be dual eligible. You can have Part Medicare and have Medicaid. No, Medicare is different from Medicaid. The Medicaid offer a lot of financial assistance. So Medicaid can pay for premium for Medicare Part B if you're eligible for both. And I do say to people, I say, if you already have Medicare, the traditional one, and you have Medicaid, there is no need for you to sign up for Medicare Advantage, all right? It's no need, because whatever Medicare, the traditional A and B will not cover for, will not pay for, your Medicaid, in most cases, we cover for it. All right, so I hope I'm able to clarify something on that. So let's go to the one we want to do today, and that is, we're going to talk about the Affordable Care Act, which a lot of people call the Obamacare, and then the Multiplan. So the Obamacare, formerly known as Obamacare, actually Affordable Care Act that was signed into law in 2010. And there is a lot of components to the Affordable Care Act, because number one, it allows for individual coverage. So meaning prior to then, you must, either you are working for an employer that your employer signed you up for health insurance. So for most part, if people are not working or they have spouse that is not working, they may not be able to have health insurance. But with the Affordable Care Act, it expanded Medicare coverage to everyone. So if at all you are not working, you are able to get health insurance. You are able to get health insurance if at all you are not working. And also with that Medicare, with that Affordable Care Act, it allows for parents to be able to keep their children on their health plan until the age of 26 if they are still in school and they're not working full time. So if you have a child up to the age of 26 and there is a document that still continues school and things like that, you can have them on your health plan. And with the Affordable Care Act, it kind of negates that, and sometimes before, if people have existing conditions, maybe you have cancer that you are receiving treatment for, you have a diabetes, any of those diseases, prior to having health insurance, they may not sign you up. But now with the Affordable Care Act, it doesn't matter if you have any existing condition, you're still eligible for that, okay? So, which are really great thing that comes with the Affordable Care Act. And the Obamacare, like I said, you can buy it yourself. So if you don't have it, if you're not working, if you are a freelancer, self-employed, small business owner, you can get insurance for yourself. But if you are not eligible for Medicare and you do not qualify for Medicaid, you're kind of like in between. You make too much money to qualify for Medicaid and you do not have enough credits to get Medicare, or you are not at the age, you are not 65 yet to get Medicare, you can get Obamacare, you can get it with any of these big companies through Blue Cross, Blue Shield, through United, through Humana, and there are other local ones, Community Health Choice, Better, so many of them. So you have like choices. The main thing with the Obamacare, with their specific health plan, is that they have enrollment periods. So they have time that is open, usually towards the end of the year, so that you can sign up, and beginning January 1st, you are covered. So there is a time frame that that is towards the end of the year. So you will see that. You can also go to healthcare.gov, healthcare.gov. You'll be able to see different things and be able to sign up for it. There are premiums, and most of the time, premiums have to do with how much you make. I know initially when the program first opened, there is a government subsidy for it. So, but when you log in, you'll be able to see which one applies to you, if you're going to get subsidy or get your things subsidized or not. So there is a premium. And the good thing is most doctors' offices, most hospitals, they accept this plan. I mean, maybe we have like few exceptions, but you're going to have primary care doctors, be able to see primary care doctors. your specialists, medications, a lot. So instead of having nothing, this is really a great one. That is one thing I like, that at least now people you can buy insurance yourself if you want it. And for most part, people are able to afford it. Okay. So the next plan, this is the last plan that we'll share. This is a Multiplan. This is a kind of a shared plan where groups of people kind of pool money together. And then when someone is sick, they pay for it. It's a shared plan or group plan. So for this particular plan, they are very flexible because you are putting in money there. They have monthly premiums that you must pay. I think the one that I have had a lot is the shared plan. The Christian, oh God, I know it escaped my mind. But I've heard about it for a long time. Shared plan, they said it's for Christians, but they open to other people. So what you do is every month you have your premium, like you will pay to all these other plans that you pay directly to them. And if you happen to need any health services, for most of the plans, you pay upfront for your care, and they reimburse you back. So that means if for all of a sudden you're sick, you go to the hospital. No, thank God in the United States, they will treat you. You don't have to put any money down for certain treatment. They will treat you and they will give you a bill. So instead of the hospital sending billing to your insurance, if you have the Multiplan, instead of them sending bills to them, they will send bill to you. You pay them, and your plan pay you, reimburse you back. And there's some plan, I know I've worked with the PHC, where they do it case by case. They can give the hospital authorization and then pay. But most plans, we have a limit. Some, I know I have worked with a couple of people, patients, that I think their plan asks lifetime payout of about $3 million. So that they have, and if probably they've spent everything, then they may not be covered. I'm not sure, but each plan is different. But that is another great plan. So if you are someone, you don't want the Obamacare, but you want to consider this, there are so many insurance that are offering this, the Multiplan. And they will tell you, most of the time, they don't have in and out of network benefits. It's pretty much that you have access to any position you want to go. You have access to any hospital you want to go. And you just kind of work with them, each case by case. And it's so easy. So I think the bottom line is every insurance, everyone should be able to have access to health plan and be able to take care of his or her own health. So we are at the age where we don't have any excuse but to just get taken care of. They always say prevention is better than cure. It is less expensive, it is less damaging, you have more control. But when things happen, sometimes it takes longer to heal, it takes longer to get back to the baseline. So you want to do everything within your power to make sure you're on top of your health. So do your annual checkups. If you are a woman, age 40 and above, do your mammogram. If there is a history of breast cancer in the family, then you may want to start early. From age 50 and above, they recommend a colonoscopy. All of those things that you need, please do them. Just make sure that you know your health. You want to know your body. You want to know who you are and know what you need to do to maintain your health. So see your doctor. If you are diabetic, see your endocrinologist. If you have any heart problem, see a cardiologist. And if you're on medications, take your medications as prescribed by your doctor. For those who have a chronic illnesses like diabetes, hypertension, most of the time you have to take the medications as scheduled, 2-3 times a day. It doesn't matter how you feel. Sometimes you do that. except for those on insulin that probably you check before you take. So please make sure you take care of your health. Again, my name is Victoria Showumi. I am a registered nurse with Petra Home Care. If this is helping you, please give us a thumb up. Please share. Don't forget to subscribe. And if you have any particular question, maybe not related to health insurance that we've been talking about the past few weeks, let us know. Reach out to us at info@petrahomecare.com or give us a call at 713-320-9619. Many episodes to come to just help you in your health and to answer any questions, clarify any concerns that you might have. All right. So thank you for tuning in, for watching this. Please share. Give us a thumb up, and watch out for another episode very soon. So we love you, and stay safe and stay healthy. Bye for now.